Hello, welcome to our webinar on glaucoma screening. My name is Jennifer Boniface, and I am one of the nurse analysts with the Provider Outreach and Education team. And today's webinar will focus on the clinical aspects for the Medicare Preventive Service. January highlighted National Glaucoma Awareness Month, and February focuses on Low Vision Awareness Month. Together, these observances are a valuable reminder to talk to your patients about eye health, emphasize the importance of preventive care, and help them stay up to date with their glaucoma screenings. Screening is key because glaucoma often develops silently, and early detection is essential to prevent vision loss, especially for those at higher risk. The good news is that Medicare Part B covers glaucoma screening as a preventive service for patients who meet at least one of the high-risk criteria. Our objective for today is to provide an overview of the clinical aspects for the Medicare preventive service of glaucoma screening. And we will cover background information about glaucoma, screening and treatment for glaucoma, preventive strategies, and the Medicare Part B coverage criteria for glaucoma screening. So let's begin with some key facts about this condition. Glaucoma often develops without any warning signs and can lead to permanent vision loss if not detected and treated early. Worldwide, glaucoma accounts for 9 to 12% of blindness cases, making it the second leading cause of blindness after cataracts. Currently, around 80 million people worldwide have glaucoma, and this number is projected to rise to over 111 million by 2040. In the United States, approximately 4.2 million people are affected by glaucoma, with nearly 50% unaware of their diagnosis. Additionally, having diabetes can nearly double a person's risk of developing glaucoma. So what is glaucoma? Glaucoma refers to a group of eye conditions that typically develop when the pressure inside the eye rises. Increased eye pressure can damage the optic nerve, which may result in vision loss and in severe cases blindness. However, in some cases, optic nerve damage can occur even when the eye pressure is normal. Although glaucoma cannot be cured, early diagnosis and treatment can help prevent or slow down vision loss. To understand what causes glaucoma, it's important to know the function of the aqueous humor in the eye. The aqueous humor is a clear, watery fluid located in the front part of the eye between the cornea and the lens. It helps maintain the eye's shape, deliver nutrients to the cornea and lens, and play a key role in regulating intraocular pressure. The eye constantly produces aqueous humor. In a healthy eye, the amount of aqueous humor entering the eye is balanced by the amount leaving it, keeping the eye's pressure stable. However, if this pressure is disrupted, fluid can build up, increasing intraocular pressure and causing damage to the optic nerve. Glaucoma is a condition that can affect anyone. However, certain individuals are at a higher risk than others. Adults over the age of 60, Black or African American adults over the age of 40, and Hispanic or Latino adults are more likely to develop this condition. Black Americans are at a particularly high risk for glaucoma, with rates several times of those of white Americans. Open-angle glaucoma is especially common in this group and is the leading cause of blindness. Hispanic adults are also at an increased risk for glaucoma, especially after age 60. The Centers for Disease Control and Prevention estimates that by 2050, half of all glaucoma patients in the United States will be of Hispanic descent. In addition, a family history of glaucoma significantly increases the risk. Certain health conditions, such as diabetes, which can develop the likelihood of developing glaucoma, and high blood pressure, also contribute to a higher risk. Certain social determinants can significantly influence a person's level of vision impairment. Factors such as lower income, limited education, food insecurity, unsafe or under-resourced neighborhood environments, financial hardship, and limited access to medical care can all influence the severity of visual impairment. For example, individuals with lower income may struggle to afford preventive eye care and routine checkups, increasing their risk of undiagnosed or untreated eye conditions. Limited education can affect health literacy, making it more difficult to understand the importance of eye exams or to recognize the early warning signs of eye disease. Unsafe or resource-poor neighborhoods may limit access to healthy foods, increase chronic stress, and reduce opportunities for physical activity, all which can contribute to conditions like diabetes and hypertension, both major risk factors for vision loss. Food insecurity may contribute to poor nutritional intake, including deficiencies in essential vitamins and nutrients necessary for eye health, thereby increasing vulnerability to visual problems. Additionally, financial hardship and lack of access to medical services can delay diagnosis, allowing preventable and manageable eye conditions to progress to more severe stages. Glaucoma can be categorized into two main categories, primary and secondary. Primary glaucoma develops without any identifiable underlying cause, whereas secondary glaucoma occurs as a result of an eye condition or systemic disease. So we're going to begin with primary glaucoma, which is further divided into two main types, open-angle glaucoma and angle closure glaucoma. The most common form is open-angle glaucoma. This type of glaucoma is often asymptomatic in its early stages, which can delay detection until significant optic nerve damage has occurred. For this reason, it's often called the sneak thief of sight. In open-angle glaucoma, the aqueous humor in the eye fails to drain properly. While the angle between the iris and the cornea remains open, increased resistance within the trabecular meshwork reduces outflow. Over time, this impaired drainage causes a gradual rise in interocular pressure, which damages the optic nerve. Because this condition develops slowly and painlessly, patients often remain unaware of any problems until they notice blind spots or loss of peripheral vision. As the disease advances and the optic nerve damage worsens, further vision loss may occur, potentially leading to blindness. Management of open-angle glaucoma may include medications, laser therapy, or surgery, all designated to lower interocular pressure and protect the optic nerve from further damage. The second main type of primary glaucoma is angle closure glaucoma, commonly known as closed angle or narrow angle glaucoma. This form of glaucoma appears suddenly and progresses rapidly. It is extremely painful and is considered a medical emergency. In angle closure glaucoma, the iris completely blocks the drainage angle, preventing the aqueous humor from leaving the eye. This blockage causes a sudden increase in interocular pressure. Symptoms may include severe eye or forehead pain, headache, redness in the eye, blurry or decreased vision, nausea and vomiting, and seeing rainbow-colored rings, halos, or both around the eyes. If left untreated, angle closure glaucoma can lead to blindness within a few days. Treatment focuses on restoring proper drainage and lowering eye pressure. This is typically achieved through medications, laser therapy, or surgery. In some cases, angle closure glaucoma develops more slowly and remains asymptomatic. This form, called chronic or slow angle closure glaucoma, is managed with medications, laser therapy, or surgery to prevent optic nerve damage and preserve vision. While we won't cover them in detail today, I'd like to briefly highlight a few other types of glaucoma. Normal tension glaucoma or low tension glaucoma is a form of open-angle glaucoma and is classified as primary. Patients with this condition have normal eye pressure but still experience signs of glaucoma, such as blind spots in the visual field and optic nerve damage. The exact cause of normal tension glaucoma remains unknown. Treatments may involve medications, laser therapy, or surgery. Congenital or childhood glaucoma is a type of primary glaucoma that typically develops in infancy due to abnormal development of the eye's drainage system. Treatment usually involves medications, surgery, or a combination of both. The last type of glaucoma we will mention is secondary glaucoma. This type of glaucoma can develop due to factors such as eye trauma, inflammation, specific medications such as steroids, or advanced cases of cataracts or diabetes. Treatment depends on the underlying cause and may include medications, laser therapy, or surgery. The most reliable method for detecting glaucoma is through a comprehensive dilated ophthalmic examination. Medicare Part B includes glaucoma screening as part of its preventive health benefits for individuals at an increased risk for the condition. This screening includes a dilated eye exam with intraocular pressure measurement, along with either a direct ophthalmoscopic examination or a slit lamp biomicroscopic examination. The results of this screening assist healthcare providers in determining whether a patient may be at risk for developing glaucoma. Glaucoma treatment focuses on lowering intraocular pressure and slowing the progression of the condition. The first treatment option is medications. Prescription eye drops are the most common approach for treating glaucoma. They work by lowering intraocular pressure, which helps protect the optic nerve from damage. While prescription eye drops cannot cure glaucoma or restore lost vision, they can help prevent further deterioration. If the eye drops are not effective, laser therapy or surgery may be recommended. In rare cases, oral medications may be prescribed if eye drops fail to achieve the desired effect. The next treatment option is laser therapy. Laser therapy helps improve fluid drainage in the eye, which lowers intraocular pressure. This procedure can be performed in the office. After laser therapy, patients typically continue using prescription eye drops and need follow-up visits to monitor their eye pressure. Since the effects may diminish over time, patients may require multiple laser therapy sessions. The last treatment option we will discuss is glaucoma surgery. Glaucoma surgery lowers eye pressure by improving fluid drainage from the eye. It is typically considered when medications and laser therapy are not effective. Examples of glaucoma surgery include trabeculectomy, minimally invasive glaucoma surgery, also known as MIGS, and glaucoma implant surgery. Additional information about glaucoma surgery is available on the NIH National Eye Institute's website, and a link has been provided on the resources slide at the end of the presentation. The most effective way to prevent glaucoma or detect it early is through a comprehensive dilated eye exam, which allows eye professionals to identify early signs of glaucoma and other eye diseases before any noticeable vision loss occurs. Early detection and treatment are essential as they can significantly slow disease progression and preserve vision. Additionally, adopting healthy lifestyle habits may play an important role in supporting glaucoma prevention and overall eye health. While these measures cannot guarantee prevention, they can help reduce risk factors that contribute to increased intraocular pressure and optic nerve damage. Recommended strategies for supporting eye health and reducing the risk of glaucoma involve a combination of regular eye care, healthy lifestyle choices, and risk factor management. The first recommendation is eating a well-balanced diet. A diet rich in fruits, vegetables, fiber, and lean protein supports overall health and provides essential vitamins, minerals, and antioxidants that help protect the eyes. Limiting sodium and avoiding high processed foods whenever possible may help regulate blood pressure and fluid balance, which can influence eye pressure. Next is maintaining a healthy weight. Excess weight is associated with conditions such as hypertension and diabetes, which can increase the risk of eye disease. Limiting caffeine and alcohol intake is a third recommendation. Doing so may help prevent temporary increases in intraocular pressure and reduce strain on the body's systems. The next recommendation is engaging in regular physical activity. Exercise improves blood circulation, helps control blood pressure, and supports overall cardiovascular health, all which are beneficial for optic nerve and overall eye function. Protecting your eyes from the sun is another important step in supporting eye health and reducing the risk of glaucoma. Wearing polarized sunglasses and a hat when outdoors helps shield the eyes from harmful ultraviolet rays. Next, it's important to wear protective eyewear when doing home repairs, home improvement projects, and while playing sports. This helps prevent eye injuries, which could lead to the secondary forms of glaucoma or permanent vision loss. The seventh recommendation is maintaining blood pressure and treating hypertension when necessary. This is crucial because both high and low blood pressure can impact blood flow to the optic nerve. Proper monitoring and treatment are vital to maintain healthy eyes and protect vision. The final recommendation is quitting smoking to reduce overall risk to eye health. Smoking increases oxidative stress and damages blood vessels, which can negatively affect eye health and raise the risk of glaucoma or other vision-threatening conditions. These preventive measures are especially important for anyone at higher risk for developing glaucoma, including individuals with diabetes, high blood pressure, or a family history of the condition. Medicare Part B provides coverage for annual glaucoma screenings for beneficiaries who fall in at least one of the following high-risk groups: individuals with diabetes, those with a family history of glaucoma, Black or African American adults age 50 and older, and Hispanic or Latino adults age 65 and older. And please note that Medicare will only cover these screenings if at least 11 full months have passed since the patient's last Medicare-covered glaucoma screening. The glaucoma screening examination needs to be performed by or be under the direct supervision in the office of an ophthalmologist or optometrist who is legally authorized under state law to perform the glaucoma screening. In this setting, direct supervision means the ophthalmologist or optometrist must be present in the office suite and immediately available to provide assistance and directions during the procedure, but they do not need to be in the same room while the procedure is being performed. Glaucoma screening can be rendered by independent or clinic-based ophthalmologists or optometrists or qualified providers under direct professional supervision using Revenue Code 770, comprehensive outpatient rehabilitation facilities using Revenue Code 770, critical access hospitals using Revenue Codes 96X, 97X, or 98X if the facility elects to use the optional payment method, skilled nursing facilities using Revenue Code 770, hospital outpatient departments using any valid or appropriate revenue code, rural health clinics paid under the all-inclusive rate using Revenue Code 770, and federally qualified health centers under the FQHC Prospective Payment System using Revenue Code 770. According to MLN 907165, Medicare Vision Services, glaucoma screening for high-risk patients can be billed using either HCPCS code G0117 or G0118. G0117 is used when the screening is performed directly by an optometrist or ophthalmologist, while G0118 applies when the service is furnished under direct supervision. All glaucoma screening claims should include the diagnosis code Z13.5, which indicates an encounter for screening for eye or ear disorders. Copayment or coinsurance and deductible apply. Once the annual Part B deductible is met, beneficiaries are responsible for 20% of the Medicare approved amount. A copay is also required when services are provided in a hospital outpatient setting. Documentation in the medical record must support that the patient meets at least one of the high-risk criteria determined for glaucoma screening. The medical record must also include documentation that the screening was conducted using a dilated eye examination with intraocular pressure measurement, along with either a direct ophthalmoscopic examination or slit lamp biomicroscopic examination. Additional documentation required for glaucoma screening includes date service was provided, office visit notes for date of service, detailing the purpose of the visit, examinations performed, and findings to track eye health over time, screening results along with documentation of any follow-up care or counseling provided based on those results to guide treatment and maintain ongoing care, and documentation to support the medical necessity of glaucoma screening, including risk factors such as family history or comorbid conditions. Ensure all documentation is dated and signed with the provider's credentials. Prior to completing glaucoma screening, ensure the patient has met the eligibility and frequency criteria for this preventive service. Glaucoma often progresses silently, showing no obvious signs until vision is affected. Without early detection and treatment, it can lead to irreversible vision loss. Glaucoma screenings are the best way to catch the condition early. Medicare covers glaucoma screenings for people who met one or more of high-risk criteria. So as a recap, during today's webinar, we provided background information about glaucoma, covered the different types of glaucoma, discussed how glaucoma screening or how glaucoma is screened, explored available treatment options and preventive strategies, and reviewed the Medicare Part B coverage criteria for glaucoma screening. On this slide, you can find links to several resources, including the glaucoma screening section of MLN 006559 Medicare Preventive Services Chart and the Medicare Claims Processing Manual, Chapter 18, Section 70. You'll also find links to the Centers for Disease Control and Prevention's webpage on social determinants of health and vision loss, the NIH National Eye Institute's webpage on glaucoma surgery, and the WPS Encore presentation on billing aspects of glaucoma screening, titled Encore Preventive Services Glaucoma Screening. Please keep this slide handy as a reference when reviewing the presentation. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat. And I'm just going to quickly look at the chat, and I don't see any questions, so we can move forward. However, if you do have any questions, put them in the chat and we'll address it before we finish up this webinar. Please take a moment to complete the survey and share your feedback. We use your feedback to develop topics for future education. And you can access the survey by either clicking the link in the chat or visiting the CMS Qualtrics page after the webinar. And that looks like this. It's a pop-up that comes up, and it looks like this with that little yellow triangle. And it is not spam. It is directing you to that Qualtrics survey. So I can't speak today. The Qualtrics survey. In a few minutes, you will receive an email thanking you for attending, which includes your certificate of achievement and a link to the survey. If you need contact hours for continuing education, they will also be in this email. If you don't see it, check your spam folder. If you called in, we are unable to see that you've been on our webinar because you won't get the email clearly. So email us at wps.gha.education@wpsic.com with the webinar name and your phone number, and we will send you your certificate of achievement. So again, make sure you send us the phone number you used while listening to this survey, while participating in today's survey, so that we can verify that your attendance and then send you out that information. If you think of any additional questions after today's event, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education@wpsic.com and put the title of this webinar in the subject line. However, if you have claim-specific questions, please don't direct those questions to us, but rather direct them to our customer service department, as we don't have access to your claim information and therefore are unable to look up your claims. Also remember that we cannot accept any type of PHI or PII via email. And I'm looking in the chat again, and I don't see any questions, so we'll finish up just a touch early and give you back some time in your day. So, on behalf of myself, Mary Sue, and all of Provider Outreach and Education, thank you for attending today's webinar on glaucoma screening. As a reminder, this presentation will be posted as an encore presentation on the Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.